It can take a bit of practice to apply a Spica bandage. Components of the video have been sped up for sake of time. Start with stirrups on the patient's paw and then apply the cast padding at the paw and work your way proximally. Once you reach the point of the elbow, go above it and as high into the axilla as possible with the bandage material before coming back down the limb. This technique will help to keep the bandage from slipping below the point of the elbow. It's important to apply a sufficient amount of cast padding to actually immobilize the elbow and the shoulder joint. Once the lower limb is sufficiently padded, move the bandage material up around the thorax. The second time around, we're going to bring the bandage material in front of the opposite or normal shoulder, then between the two front limbs. Follow the flow by pulling the bandage up above the near thorax again, and this time going forward between the two front legs and over the affected shoulder. This forms the basis of the crisscross or cross your heart type of bandage. So we're going to continue to add more padding and make sure we get the shoulder well padded to help immobilize it. Pull the bandage around the thorax again, and this time we're going to wrap around the elbow shoulder area before crisscrossing in front of the far shoulder. We're going to continue to add padding to that cross your heart bandage. This time as I come forward between the front limbs, I'm going to wrap around that elbow again and cross over the shoulder just to help further immobilize it. Be sure to add enough cast padding to this bandage to create the effect that you want to immobilize the elbow and shoulder joint as much as possible. Continuing with that crisscross and around the elbow, around the shoulder pattern that you're looking for. It's important to take the time to place the bandage material where you want it to fall, especially when applying such a large, difficult bandage. Once there is sufficient amount of cast padding on the limb, then the cling layer or the compressive layer is added. Always start at the toes, work your way up, use nice even compression, and I usually like to do at least one up, down, and then go back up before I go around the body with this bandage. Once I'm ready to start doing the body portion of this bandage, I'm going to use the same pattern as I did with the cast padding. I'm going to start by going directly around the thorax, and then my next turn will go in front of the opposite or far shoulder, normal shoulder. Back in this particular case, I'm going to go right around the elbow, back around the thorax, forward between the front limbs, back around the thorax again, applying a sufficient amount of cling or compressive layer until I have a certain amount of structure to my bandage. With the cling layer applied, I can now turn the stirrups over the cling so that they will stay up and keep the two middle toes visible. If a splinted bandage is desired, then the splints should be applied after the cling or compressive layer and before the vet wrap or protective layer. The final or protective layer is then applied. Once again, starting distally at the paw and working your way up and eventually around the thorax. Follow the same cross your heart pattern that was used with the first two layers, and be sure to really get that elbow and shoulder covered and appropriately immobilized or restricted with your bandage. It is important not to apply this stretchy layer too tight over the chest as not to restrict breathing. Brands of this protective layer can be rather sticky, just like this one, and it's important, very much important, not to allow it to get too tight when you apply it, so be cautious. Ensure that all the previous layers of the bandage material are well covered with your protective layer. Please watch the video on Jennifer White's bandaging technique to help you with getting the bandage along the paw started. She has a technique that works well to help keep those two middle toes exposed and keep the bandage a little bit more comfortable for the animal.